from the News Channel 5 network. This is Medical Mondays.
Be honest, what sport do you see the most injury from?
Football.
Yeah, football. Okay. And like you said, you really treat people of all ages. I mean, it's not just the pros, it's high school level too, or even college, huh?
Yes, that's correct. Currently, I'm actually the team physician for Ravenwood High School, and we have seen a whole lot of injuries this year, unfortunately.
Already, too, huh?
And we are relatively early in the season, but we've had quite a few significant injuries, also quite a few sprains and strains where people will be out for, days to weeks at a time. But unfortunately, we've also had some kids that have had injuries to the point where they're done for the season.
Sure. So. Let's talk about some things that you might hear on the sidelines of a certain game when we're talking football, like a torn ACLU or some sort of lingo that people might not understand. But does it all go back to the knee? Is that the general area we're talking about?
So your ACL, it stands for anterior cruciate ligaments. There are actually two ligaments that cross in the middle of your knee. There's your anterior cruciate and posterior cruciate ligament, and cruciate just means cross. So turns out the one that crosses in front they call anterior, the one that crosses in the back posterior. Not too difficult. But the anterior cruciate ligament, or the ACL, is the one that you will always hear about on TV. It's the one that if you do injure that, you're done for the season, and it just doesn't get better without surgery.
Yeah, when you hear of a tear, that sounds like something pretty significant. So there's not really recovery time or anything like that. You can get treatment, but you're not going to be playing any kind of sport anytime soon.
That's typically back to what we were discussing earlier on, where something really bad has just happened. Most people realize there was a big pop to their knee. They don't get up and say, hey, I want to finish playing the game. They're typically grabbing a hold of their knee, rolling around, yelling, screaming sometimes, but they typically know that they're done.
Just that much pain. All right, what about PCL or LCL?
So your PCL is your posterior cruciate ligament, and it also runs in the middle of the knee right behind the ACL, and it's actually not injured nearly as frequently.
Okay.
So the ACL people will oftentimes tear when they plant their foot to try and change directions.
Oh, okay.
Usually when we see someone that's injured their PCL, it's that they've either fallen directly on their knee, or oftentimes it's people that are in car wrecks where they'll get driven, we call it a dashboard injury, and their knee gets driven into the front of the dashboard and it actually pushes your shin bone backwards relative to your thigh bone, and you can tear your PCL that way. Then there are also two other collateral ligaments. There's your MCL, or medial collateral ligament, and your LCL, or lateral collateral ligament. And those ligaments are actually outside of your joint and have a relatively reasonable blood supply. So a lot of times if you injure those, you're really only out for 3 to 6 weeks because your body can heal those. Unfortunately, ligaments that reside inside of joints just don't have very good blood supply, and that's typically why we have to go in and reconstruct them if people tear them.
All right. When someone comes in with any of these kind of injuries, obviously I'm guessing an x-ray or maybe even nowadays an ultrasound, something like that is done. But what are the diagnostic tools that you all use to decipher what's wrong? So
typically you can get a pretty good idea just by talking to the patient as to what exactly had happened. But if you come into the office, you'll almost certainly get an x-ray. We want to make sure that there are no associated fractures or any other injuries. A lot of times in our younger kids, it's important to see what their growth plates look like. A 14-year-old's knee looks a lot different than an 18-year-old's knee on an x-ray. And certainly want to respect the growth plates if you're thinking that they may need an operation down the road. But typically to actually see inside of a joint, you need to get an MRI. The x-rays, really all they do is pick up on the calcium and the mineral in the bone. So we can see the bony structures very well, but you can't see ligaments, tendons, you can't see cartilage actually on a plain x-ray. So for most of the things that we do in order to make the true diagnosis, people end up requiring an MRI.